And now I'm excited to invite Kishore Iyer up to the stage. Kishore directs adult and pediatric intestinal rehabilitation and transplantation at Mount Sinai Medical Center in New York. He will share his story about the unique challenges of providing surgical care in remote areas around the world. Kishore.
Thank you, Leah. I was actually going to say good morning, but now I really want to say, whoa, that's a hard act to follow. So let's hope it continues to be a good morning. I was asked to share with you my vision of applying the ECHO model to surgery globally. Let me take a step back and give you a little bit of background. I'm an adult and pediatric transplant surgeon doing mostly intestine transplants. What does an intestine transplant surgeon really do? Think of all the good food we've had in the last few days here. Now think of somebody who cannot eat or drink to meet their very basic needs to survive, to be dependent on intravenous nutrition delivered through an intravenous catheter placed in the heart, connected to a pump every night, all the alarms and the things that follow. Houston, we may have a little problem. I'm not yet ready to fund anything. These patients lead really quite difficult lives but are dependent on this therapy. And the sickest of these patients come to the likes of me for intestine transplants, and in some cases, really very complex multi-organ transplants. There should be a slide or two. If you can pull up the slides while I start the story. I want to share the story of little Aniston. Aniston was born with a rare condition that, unfortunately, he was born with all of his intestines in place, but they just simply did not work. So as you can imagine, from day one of life, Aniston was dependent on intravenous nutrition. However, in addition to this, he suffered a massive catastrophe where he lost the blood supply to his intestines, and in a somewhat heroic operation, survived just. At this point, the parents, in some desperation, reached out to us, and eventually we made the trip. I'm going to make one more attempt at pulling up slides. If not, we're going to do this without the slides, and I'll have to be a better storyteller. So Aniston came to us. If I could not show any other slide, I wish I could show you a picture of this delightful young man at the age of about 2, with no intestines, with his intravenous infusion running. We carried out a multidisciplinary transplant evaluation and decided he was a good candidate. We listed him for intestine transplant. Fast forward, take my word for it, right on that picture, there's a slide of little Aniston enjoying a wonderful plate of what looked like it was spaghetti bolognese. And there was actually another picture of Aniston enjoying the best of a nutritious American school lunch. He looks less happy in the second slide. But we could all agree that overall, despite Aniston not being impressed with the food he was served at school, this was clearly a good outcome. But let's come back to what we are here about, which is, What if Aniston had not been born in these United States? On that slide, you can see we took a 20-hour flight to Somaliland, Hargeisa, which is a very interesting country. But geopolitics aside, it's a country that's not recognized by any other country in the world, not by any official body, not by the UN, a fledgling, struggling democracy. But as soon as we landed, I was struck first by, in this deeply Islamic country, I met members of our team who we hadn't hitherto met, Dr. Mariam Daher in Harabaya, a fierce advocate against female genital mutilation, widely known in the country for her efforts. We met Dr. Hassan Daoud, a young doctor with an unbridled optimism, and you wonder, where does that come from, that he can believe with such conviction that they're going to change the face of healthcare in Somaliland. But right there, find me afterwards and I'll show you these pictures. They were insistent that we visit the historic caves of Las Gil with some of the oldest examples of cave art dating back to 4000 BC. But right next to that picture was a stark reminder of the civil unrest and strife, as we were assigned 2 armed escorts carrying what looked like AK-47s. And I was, you can imagine, just a trifle disturbed when one of them very kindly offered to take a picture but refused to put down his gun. So there were these reminders. No surprise then that Somaliland has one of the worst healthcare systems in the world, has among the lowest GDPs, ranks 161 out of 163 underdeveloped countries for healthcare. And as we visited various hospitals in our effort to try and deploy ECHO for system strengthening in pediatric surgery, it was clear that the challenge was really almost forbidding. In a country that requires 20 pediatric surgeons, there are 0. Of all operations in children, about 1/3 are performed by adult general surgeons. 1/3 are performed by non-surgeons, physicians, and 1/3 are performed by non-physicians. So come back to my little Aniston, let alone intestine transplant. A family having a child with appendicitis, pediatric trauma, burns, really common conditions of childhood, common surgical conditions of childhood, has really no realistic expectation of survival, let alone a good outcome. But there is nothing special or unique about Somaliland. On that map, you can draw an imaginary black line. Oh, I see hope. I'm going to interrupt myself and ask the organizers to forgive me my time breaks. I draw attention to the catheter and enjoy with me the joy of a child who is not living in his illness. At least see the spaghetti. At least see the spaghetti. And I wasn't lying when I told you the school meal did not cause so much glee. And there was her gaze. I'm going to run through this. This is not what we planned, but ECHO is about being nimble and switching sets. And this was, most of all, Mariam and Hassan and the strange guy next to them. The coffee was good. I'm very happy to show you the pictures of Las Gil. I'm actually pleased that I wasn't lying. Okay, you can see the state of healthcare. And with good intentions, I don't know if you can quite see that in this relatively dilapidated OR. At the bottom of the WHO surgical safety checklist that most of us perhaps have heard about is a note, make sure to kill the flies. But, as I said, there's nothing unique or special about Somaliland. That imaginary black line, for the purists among you, the Brandt line, you could drop a pin anywhere below that line and find a system that is severely stressed in providing surgical care to children and really to most of their populations. At best, delivery of healthcare in these areas is patchy with a clear divide between the haves and the have-nots. Enter Project ECHO. Project ECHO is all about democratizing knowledge, sharing best practices in an effort to improve outcomes. One of the best examples of using the ECHO model for surgery came from the Safe Surgery 2020 initiative, where among a variety of multimodal interventions, they used the ECHO model to try and improve surgical outcomes, focusing on perioperative care, implementation of the WHO Safe Surgery checklist, intraoperative monitoring, ensuring good oxygen concentrations, postoperative care, focusing on prevention of infections. And what Safe Surgery 2020 showed was the power of cooperation, of knowledge transfer, of skill sharing, and of building community to improve outcomes. When I think of ECHO in surgery, I see a meat in the middle problem. I do have a vegetarian option. And what do I mean by that? When you think of the surgical continuum, you can think of the first slice of bread as representing preoperative care, timing of surgery, optimizing nutritional status, defining goals of care, choosing the right operation for the right patient at the right time. The second slice of bread, focusing on prevention of infections, prevention of complications, rehabilitation, recovery, managing long-term complications. See the problem? The meat in the middle. So ultimately, for us to really leverage the strength of ECHO in surgery, I do believe we have to find technical solutions that allow us, in some hybrid fashion, to layer the strength and power of ECHO that we've seen in spades to the surgical problem. Fortunately, there are good solutions coming down the pike with the use of augmented virtual reality. One of the leaders in the field is a young startup in the UK called Proximi, started by an amazing surgeon, Dr. Nadine Haram, a plastic surgeon. And what Proximi does is it allows recording and monitoring and transfer of real-time data from the OR with acceptable quality to allow monitoring, oversight, and ultimately, perhaps, is my hope, mentorship. One good example of this was a short study which showed that in a 13-month period, using augmented virtual reality for cleft lip surgery, combined in a hybrid model with in-person visits, 2 Peruvian surgeons learned cleft lip surgery, were mentored on cleft lip surgery, and I'll just get to the bottom line. At 30 months, no children with cleft lips required transfer to a tertiary center. So this shows us the promise of technology layered on top of ECHO as we see it. So ultimately, what this comes back whole circle. If we can figure out how to solve the meat in the middle problem, it may not matter where a child like Aniston is born, forget intestine transplants, but at least the common surgical conditions of childhood, common surgical conditions in adult patients, such that it doesn't matter whether he's born in New York or in Hargeisa, you can expect reasonable surgical outcomes. And perhaps it won't matter where people are. Thank you very much for the privilege of the floor. Apologies for the technical difficulties.